I will not go extensively through what is the joint external evaluation process, because you know it, you have seen the action and you've been part of this. In a way, we are all together JEE. So I also do not have to go back too much to the scores. You know that capacity 1 means in a way that there's no capacity on that specific technical area, and that a score number 5 means not only that everything is in place, but also that you are assisting other countries on this specific technical area. This is our team. I will ask them to present themselves one by one when they present the technical area that they are lead in. But there are some around the team that are extremely important for the functioning of the whole team. And I want to mention them and I want to ask your applause. First of all, it is Kiki. Kiki, can you stand up? You stand up because I want to thank you. You are part of our team and you are the connection between the WHO office in Nigeria and between the external evaluators. Thank you. Thank you. And the second that is part of our team is Kola. Kola, can you stand up? Kola is also coordinating. He's coming from Nigeria, but he fled to Nairobi. And he's working now from Nairobi. And he was of extremely importance to us. He's working in the regional Africa WHO office. So he's coordinating what's happening here with what's happening all over Africa. Thank you so much, Kola. Thank you. And then somebody, no one of you, well, you've all seen her, but you haven't heard her because she is not our speaker, she is our writer. And that is Kisum. Kisum, can you stand up? Kisum is writing and coordinating, she's not writing because we are writing our own report, but she is coordinating the development of the report that we will send to you. So here you can see the team again. Yesterday we have been on field visit and this was an extremely important part of the JEE. We could see whether what we were discussing here in this nice meeting venue is also happening in practice. So we've been to several sites, we've even been to Lagos. There are still parts of the external team coming back from Protocot. We've been to many places and at the end of the discussion we will give a short first overview of what we saw during our field visits. But here you can see already a compilation. You can see that I myself went to the slaughterhouse in Karoo. So, overarching strength that we measured during the week, so not on each specific technical area, but on every technical area. The strength that we are really impressed by from you in Nigeria is your institutional development. Your ministries are functioning, are discussing, are making plans. You try to reach out to the state levels. And we fully understand the difficulty of such a huge and enormous country as Nigeria is. But you manage a lot. We also applaud you yourself. And I really would like to give an applause from the external team to all the professionals from Nigeria. You are, let's applause. You are a developed and you are a skilled workforce for Nigeria. You have effective working relations. We've seen you sitting on the table here, coming from different ministries, from different departments, from different agencies, and you are working together. But there are also areas that need strengthening. And you will see this coming back in the recommendations and in the priority actions for each technical area. But in general, and I will come back to this in the overview I will give to the high-level people at the end of this morning, in general, coordination is a very important point. Coordination between MDAs, coordination national, federal, state and local levels with the local communities, coordination between public and private, and also coordination with the international agencies. A second area that needs strengthening is implementation. So you will see this coming back in the priority actions again and again, coordination and implementation. And when you start, or you start already, but when you really put focus on implementing your plans, that is what will move Nigeria from the scores you will see today to better scores over 5 years. So, this being said, we are coming to the scorecard. And we will do it as such that the external team is sitting on 2 tables and they will present themselves shortly from technical area 1 up to technical area 19. I will bring the slides forward as I'm standing here, and then they will give in 3 minutes the scores and the priority actions. So I would like to introduce to you the technical lead for legal instruments, being the first technical area, and that is Sarah Emami. Sarah, do you have a mic? Is it possible to have a walking mic to the table of the external evaluators? There it is. Okay, Sarah, introduce yourself.
Okay, thank you very much. My name is Sarah Emami. I'm from the United States. I am the legal director for Resolve to Save Lives, and it's been a pleasure to be here this week. So I'm going to speak for just a few minutes about legal instruments. We have an American author, Mark Twain, and he said, "Thunder is good, thunder is impressive, but it's lightning that does the work." And here is your team that is working on lightning. These legal instruments underpin all 19 technical areas, and the work to date has been impressive, particularly given the federal structure of the country. So there has been some headway in conducting the subnational legal assessments of the health laws, and there has been I think, completion of much of the work at the federal level. So you can see here that the indicator for P11 is 2, and we have a couple of priority actions. The key among these is to not only conclude the outstanding subnational legal assessments, but also, based on those assessments, to then develop and revise necessary instruments for implementation at those levels. I think the other priority action, which is on another page, which is fine, is the need for a dedicated budget for these activities. I'd like to move to our new indicator under this section, which is under Gender Equity and Equality in Health Emergencies. This is a new indicator, and as you can see, the score is a 1 because no assessment has been carried out to date. But I think there are important baselines to build on. There are legal instruments which recognize the right to gender equity and equality, and there are assessment exercises that have been done, but an IHR-specific assessment has not yet been done, and that's why we are here at A1.
Thank you very much, Sarah. So this brings us to technical area 2, and that is financing. And I happen to be myself the technical area lead on financing. So in financing, we had two indicators, and both indicators scored a 2. And what is, as I've said the whole week, the most important are the priority actions. And the priority actions we identified together. We reached consensus on this with the national team, and I thank them for that. It is to develop a framework for monitoring and accountability mechanisms for IHR and NEPS implementation across the ministries, departments and agencies at national and subnational level. So it is breaking down the financial silos. It is showing where the money is coming from when you have something that is partly coming from, for example, agriculture, partly from health, that's going to the national and to the subnational level. You have to show it, and you have to develop a framework. You need to, and that's the second priority, elevate health security into national budget processes. This means that you need to earmark specific money for health security. Sorry, I'm going too far. Further, a third priority action is to operationalize health emergency finance mechanisms. This means implementation. So you need not only to make plans, you need to start implementing them. Of course, it is already started, but really focus more on implementations. Think back of the measles vaccination, for example. The fourth indicator, the fourth priority action is to develop a public health emergency fund within 5 years. So these were the priority actions as coming from the technical area financing. I now kindly give the floor to the third technical area lead, and that is Noor. Noor, you the floor. Noor, you are technical area lead on IHR focal point functions.
Good morning, colleagues. For the IHR technical areas, we have got 3 areas that we extensively discussed, and we agreed on that the country has some capacities, but it needs further strengthening. So the number 1 is the conducting an end of evaluation for the National Action Plan for Health Security. This is important because at the end, what lessons we learned from the last planning, so we need to carry on and build on for the future planning as well. So, and the next one is to develop a 5-year action plan based on lessons learned from the previous one. So this needs an extensive and the multi-stakeholders approach to bring together and to develop the next 5-year plan. So the third recommendation is to design and conduct a sub-national health security assessment exercises across the state and develop the corresponding state-level action plan for the health security. So involving all the sub-national stakeholders into this planning. So these are the 3 areas, and review and update the multi-hazard contingency plan at the all-hazard approach basis. Evidence-informed strategy and disseminate it, yes. Develop an evidence-informed advocacy strategy to disseminate it through the national and international level. So evidence-informed, the advocacy strategy, what we have learned, and what are the evidences based on our past experiences, and accordingly prepare the intermediate level planning. So, and finally, the review and update the multi-hazard approach and also the contingency plan based on the multi-hazards approach. So these are the key recommendations out of many other also the action areas that we identified. Thank you.
Thank you, Noor. And you forgot to introduce yourself. Noor is coming from Australia.
Hi, sorry. My name is Noor Alam. I think I introduced before, but anyway, once again, Noor Alam. I am the Australian government epidemiologist, but I'm representing myself here in this occasion. Thank you.
Thank you, Noor. The next technical area is antimicrobial resistance. The team lead was Guy Ohirweoluya, and he is still on transport to here from Protocot. So the co-lead, Tendai, will give the presentation. Please introduce yourself shortly and then go over to the priority action.
Good morning once again, colleagues. My name is Tendai Makamure, and I am based in the WHO Emergency Preparedness Hub in Nairobi. So I'm going to give the priority actions that were agreed on in the AMR Technical Working Group. And the first one, which would be priority, will be to finalize the National Action Plan 2.0 and start the implementation, and to include a costed operational and budgeted operational plan and monitoring and evaluation framework. The second one will be also focusing on developing an advocacy plan for the domestic budget.
Yes, there
Develop
is the slide.
an advocacy plan for the domestic dedicated budget, followed by developing an integrated antimicrobial resistance surveillance system with priority pathogens, and for this you would also need to conduct an One Health AMR prevalence survey. The following one is on developing also standard case definitions. If you go to the next slide, standard case definitions for multi-drug resistant organisms which are going to be used in Nigeria by healthcare facilities. And lastly, mapping existing laws for One Health from all the tripartite sectors, reviewing them and updating them to ensure that the national legislation will cover all the aspects, including the implementation framework. Thank you.
Thank you, Tendai. Now we turn to zoonotic diseases, and I give the floor to the team lead, Richard Garfield. Please introduce yourself and give the scores.
He has just introduced me. I'm still Richard Garfield from the U.S. Centers for Disease Control and Prevention. There is maybe less institutional development, organizational capacity in zoonotic disease than some of the other areas where advances have been made. So the need is for strengthening of surveillance and integration of surveillance for zoonotic diseases with those conditions affecting humans, animals, and environment. This is a major challenge in many areas, and it is a challenge for you with separate surveillance systems. So zoonotic disease surveillance needs to be strengthened and integrated for analysis with other areas. You have more opportunities to review the outbreaks that actually occur and learn from them. The integration of operative reviews, not multi-days with hundreds of people, but every time there's an outbreak and a response, you can integrate that into your system so that you can improve the identification and reporting. And the field visit that my colleague took to the abattoir showed that there was a need to implement animal identification practices that didn't exist in the abattoir, among other activities to improve the quality of abattoir work.
Thank you, Richard. And you can keep the mic because the next technical area is on food safety, and you are technical lead. You don't have to introduce yourself anymore.
Okay. So food safety, in fact, we were just talking about it with zoonosis, because that's part of your food. There is a lot to do in every country for food safety reporting and surveillance, because these are the events that occur most often that get reported into the surveillance systems. and they're reported so often that they may be discounted. As you move toward more surveillance in states and in local areas, there's going to be a great need for developing training for the people who are working in those levels. You have some staff in states, and that's the arena for development because that's closer to where the daily life of people are, where diseases are identified and responded to. So in many areas, but including in this area, there's a need for training. And a lot of the training can be done self-training. That is to say that leadership develops training materials that people study themselves. That's the easiest and quickest way. It's not the only way to do it, but more and more, technologically speaking, we are developing materials so that people can learn on their own, and there's less need to bring everybody together every time. You have so many staff to train, and so much turnover of personnel that standard training materials need to be developed, certainly in this area. Foodborne diseases are, illnesses are not fully integrated into the ISDR system. And that would be sort of low-hanging fruit at a federal level, but again, training so that people are actually doing it. And then the handling of food materials, not only related to animal food products, but others. There's a great need to develop communication so that people can recognize and provide hygiene for themselves. So this is an area that relates to health communications, another section of the JEE.
Thank you, Richard. Then we move forward to the 7th technical area on prevent, and that is biosafety, biosecurity. May I give the floor to Geoffrey? And please introduce yourself.
Good morning, colleagues. My name is Geoffrey Jagero, FHI 360 from Kenya. On biosafety, biosecurity, we have quite a number of priority actions that we identified. We and the national team felt there's a need to put some spotlight on specifying responsibility of key government MDAs with generic terms of reference, specifically for coordination purposes when it comes to addressing inventory of high consequence pathogens. And number 2 is the need to work with responsible MDAs to plan and operationalize the biosafety, biosecurity pre-service training curriculum that was well presented here. So there's need to breathe life into this so that the country can begin to develop that critical mass of biosafety, biosecurity professionals. The next is to look at increasing the number of professionals trained in biorisk management both within the health system. Then this should cut across national and subnational levels. The country should also be able to plan and conduct defined periodic biological risk assessments in laboratories, and this should target all levels across all sectors within the Nigerian biosafety, biosecurity ecosystem. They should also be focusing on working with the MDAs to develop biosecurity framework that should specify an oversight responsibility for dual-use research of concern and responsible conduct, code of conduct for life scientists in the country. So on the indicators, the first indicator is targeting whole of government biosafety, biosecurity system, and this had a score of 2 based on the body of evidence that was provided. The second indicator is on biosafety, biosecurity training and best practices in all relevant sectors, and the score was 2. Indicator, I think, yeah, that's all for biosafety, biosecurity. Thank you.
Thank you very much, Geoffrey. Then we turn to the 8th technical area, the final technical area on the chapter of prevent, and that is immunization. Richard.
and I'm still Richard Garfield. I love the area of immunization because where some of the topics are negotiate and coordinate and sort of that's very process, immunization is a practice where the action is directly related to the outcome of interest, which is the protection of the population. So it's practical and it's a good way of monitoring all of your systems. To the degree that you need to act on immunization, all the other topical areas where we want to work will need even more action because immunization is straightforward and has been somewhat developed over many years. We all saw with the COVID pandemic the problem of misinformation. This is not a problem that's going away. Mass communications and opportunities to spread misinformation will only grow, and our need will only grow to continue to improve the dialogue, not just the provision of information, but communication back and forth with community leaders and with mothers and with everyone, so that good information is there as a base to help protect people from misinformation. So the recommendation there is the aggressive development and dissemination of communication materials. There is an opportunity to develop more working relationships with secondary and primary health facilities where immunization levels are not high enough. Use them as a base. We know that there are parts of the country where there is hesitancy to accept immunization, and there are, in those and in other areas, inaccessible or difficult access areas. And the primary healthcare system, to the degree that it exists in some of the areas that are difficult access or near to them, is your opportunity to reach out further from those to reach the rest of the population. And you yourselves had identified the need to improve the management of the materials and in the information related to information systems, so that we are collecting information, but we are using it to manage our actions. That's it.
Thank you, Richard. Then we move to the second chapter, Detect. And in Detect, we start with National Laboratory System, and that is Geoffrey again. Geoffrey.
It's Geoffrey Jagero again. So on National Laboratory System, quite a number of priority areas that were identified and agreed on with the national team. There should be a concerted effort to expand the national integrated sample transportation system and referral network to cover all priority diseases. There's something currently going on, but there's need to really focus on that to move the country forward. And number two, there should be an effort towards developing and implementing a national diagnostic network optimization framework. This should really address all the needs across all the tiers, from primary, tertiary to the national level. And this should also be done to cover all the both public and private based laboratories. And number three is a priority area, is sorry. Yes, to expand the need to work with relevant MDAs to increase at least by sixfold the number of people trained and certified as biomedical engineers. There has been some efforts and some significant gains in that area, but Nigeria is a very big country, 36 states plus one. So I think we agreed that there's need to really put some spotlight on that area and enhance that capacity. Number four is to empower the accredited national reference laboratories to expand the quality improvement systems across all the tiers of the laboratory network. And this, I think, came out strongly because the national laboratory system should also be the one that supports other core technical, other core capacities such as AMR and IPC. So by working on that, they will be helping alongside, they'll be helping and strengthening all the other core capacities. And lastly, develop a plan to implement remote logging and interoperable LIS that should cover all the priority pathogens at all tiers of laboratories across all the sectors. This has been an effort and some achievements on this area, but then again, we should work towards strengthening this. On the scores, first indicator is specimen referral and transport systems scored a 2, national quality systems scored a 3, the laboratory testing capacity modalities scored a 3, and lastly, effective national diagnostic networks also scored a 3. Thank you.
Thank you very much, Geoffrey. Now we move to Detect 2, the technical area on surveillance. I give the floor to Buba, and please introduce yourself shortly.
Yes, good morning. My name is Buba Manjam from the Gambia. So yes, first of all, I have to announce that after the visit, we noticed a lot of, we proved that you've done a lot of work. So for surveillance, for the early warning, you scored 3, and then the priority actions is to integrate early warning surveillance functions in private and public sectors across One Health approach, that is using One Health approach. D2.2, early warning surveillance functions. The score is 4, of course, and then the priority actions are full-scale deployment of SOMAs to health facilities, both public and private. For D2.3, analysis and information sharing, very important and key. That involves training and retraining of staff on epidemiological investigation, especially at subnational level across all sectors. So we thank you very much for the great efforts you put forward.
Thank you, Buba. That brings us to the technical area of human resources. May I give the floor to Sarah?
Hi, and thanks very much. Again, I'm Sarah Amami. So we're going to just cover the technical area of human resources. We had 4 indicators here. So we're looking at the multisectoral workforce strategy, human resources for IHR implementation, the training, and workforce surge short-term during a public health event. So Nigeria has a lot of strengths and a lot of challenges here. Strengths being an incredibly dedicated and professional workforce. Some challenges, however, being the absolute size of the population to be reached in terms of healthcare, and the difficulty of multisectoral coordination. So after discussion, we wanted to highlight the need for development of mechanisms to address those issues of both recruitment and retention of skilled professionals, with a few ideas for that. And we also wanted to emphasize the importance of developing cross-sectoral collaboration here between the animal health and animal, human, and environmental health sectors. In terms of scores, we landed on 3 for the multisectoral workforce strategy, which has been developed, the resources available for the implementation of IHR, and for workforce training.
For the final indicator on workforce surge during a public health event, clearly the plans have been developed but not yet implemented, and therefore this score is a 2. Thank you.
Thank you, Sarah. We move to health emergency management. We are now turning to the response chapter. This is, again, technical lead Richard Garfield.
Hi.
Hi.
Thank you. The National EOC has responded to 23 events in the last 5 years. I think there are many more events, and as I had said before in related activity, the more events you have, the more opportunities you have to learn where the limitations, bottlenecks, both systematic and low-hanging fruit for improving the systems are. So we were impressed in the field visit by how active the EOC is in gathering information. And I look forward to a time when the EOCs in the states have more action on their own and relate to the national EOC back and forth for the coordination both of information and response, and for learning from each outbreak. And that is the second bullet, really. We started with WHO developing a model for after-action reviews, which was kind of heavy and bureaucratic. We want to move to short, operative learning so that it can integrate easily into the system. And one of the most active or practical pieces of that, you've already heard and are in process, which is using the timeliness metrics to identify how long it took to identify the condition, report, and respond, 717. So that is the quantitative aspect of after-action review. But it can be integrated into the current review, the review that's ongoing for your current events as well, in a weekly update. Again, the opportunity and the need with so many staff, especially staff in states and local areas who have other responsibilities in the health system and are only partly involved in this, for self-training activities, you can standardize this so that people can have a ladder system of developing their skill, and then you'll know who is prepared to be a cooperative partner in what area. We also call this just-in-time training, because you're responding to this, here's a piece of information you need, a 5 or 10 minute, and then we'll be able to work together more effectively. That's self-directed learning materials. And the final indicator in the area of emergency operations centers is research. So we focus in US CDC on operations research or implementation research. And that relates to what I was saying already. Other people may do other kinds of ideological research or the nature of systems or organizational theory. We have the opportunity, when we're reviewing what our work is, to see what helps to implement better. That's implementation research, and that's where NCDC can really move forward. Thanks.
Thank you, Richard. This brings us to linking public health and security authorities. I give the floor to Geoffrey.
Thank you, Hank. The challenge with this co-capacity is that it demands so much, and yet the indicator is just one. And so you could do so much on probably an area like administrative actions, but fall short on areas of operationalization, and still we will still have missed the mark. Number two is the need that I want to emphasize, not just for Nigeria, but for other state parties, that this is this is the core capacity that should prepare a country on how to respond to ambiguous events or deliberate events. And so, some of the areas that we looked at in terms of the country putting a spotlight on for the next several years in terms of strengthening is empowering the ONSA, the focal person, with real-time data visualization. This is critical for monitoring, for evaluation, for timely decisions, especially during those ambiguous or deliberate events. And two, the need to develop, validate, and implement a national protocol for joint investigations. The key word there is joint investigations. Number three is to look at how to increase the number of public health and security personnel who are trained as frontline responders for ambiguous and deliberate events. I'm stressing this because we could have been training, we may intend to train, but it's important to appreciate that we need to train for the right, we need to train our personnel to respond to what we would expect. So we need to look at the right training areas to focus on, and that is for DEs and ambiguous events. And lastly, there was need to review, sorry, you can go back. There was need to review these employment levels and center goals. Essentially, we need to have a plan, not just on how to train, but how to retain the people we have trained. Human resource development is an expensive exercise. So we can't be expecting to train people today and tomorrow they leave. And so we need to have a plan for that. Lastly, is to develop a plan and work with WHO country office, hopefully. This tool is probably the best we have at the moment. It is only available to WHO at HQ and also at country level, and that informs the need for the countries to work with the country office to be able to conduct self-assessment in the area of ambiguous and suspected deliberate events, moving the country forward. And so for the score on public health and security authorities, cutting across law enforcement, border control, and customs, of course, linking this during a suspect or confirmed biological or chemical or radiological event, the score is 2. Thank you.
Thank you, Geoffrey. Now we turn to health services provision. I give the floor to Noor.
Hello, good colleagues. Good morning again, and this is still Noor Alam from Australia. So this health service provision technical area, this is a new area. It was not in the last JE. So this serves a good baseline for the future our work. So under this technical area, there are 3 indicators, and these are very closely interlinked. So the priority areas that the country team came up with, and we had an extensive discussion, these recommendation or the priority areas, these are also interlinked, and they are not necessarily standalone against each of the indicators. So rather they are overlapping in many ways. So the first priority action we discussed and we agreed on is to develop a governance, accountability, and coordination framework with periodic evaluation, periodic review for maintaining the essential health services during emergencies. So when you say essential health services during emergency, as I may say, that these falls into not just one area, but it involves also case management, utilization of health services, and also continuity across the spectrum of health services. So the second priority areas is developing a monitoring, evaluation, accountability, M&E. In a broader sense, we call meal framework for implementing post-event improvement plans. So every event that how the country teams operated and what lessons we learned. So based on that, it should be included in the meal framework. The next one is establishing a telemedicine options for service delivery during emergencies. We have seen that many people have access limitations during emergencies. So during COVID, we have seen that that experiences in many ways. So the country program have come up with these suggestions for establishing telemedicine framework. So for the case management, this is still emerging, this area, and it's a lot of opportunities for development. It is an emerging area, so a lot more works to be done, for the future. So the last recommendation is the resource mobilization for the increased frequency of the simulation exercises. Simulation exercises in all three areas we identified are very important, and therefore needs a clear resource allocations, not necessarily the finance, but also the human resources, accountability, and also the responsibilities, delegated responsibilities, so that we can identify and make the assessment for the post-event after the event has occurred at all levels. So these are the key priority action areas that the country team and the external evaluation team agreed on. Thank you.
Thank you, Noor. We turn to infection prevention and control. I give the floor, and I kindly ask her to introduce herself as well, to the co-lead for this technical area, Tendai.
Good morning once again. I think, as you already know, I'm Tendai Makamre. I'm the co-lead for the IPC. So I think, as they say, Rome wasn't built in a day, and I think Abuja was not built in a day, but we have made significant progress in terms of infection prevention control in ensuring that we put the foundations in place, and hence you will see that the score for IPC programs is 3. And for the priority action for this indicator, this is the key block that will enable the country to drive the IPC program to all the healthcare facilities in the 36 states. And the first priority will be to institutionalize the program by ensuring that we get the national IPC policy, which has been reviewed, approved. We also finalize the IPC legal framework development, and also we start implementing the budget advocacy plan for infection prevention control for the subnational levels. The second one, priority action, which is more focused on strengthening the workforce in terms of their technical expertise in infection prevention control. The recommendation for the priority action will be to develop the national IPC in-service training plan, and also while also ensuring that the pre-service curriculum is put in place so that the healthcare workers are trained. They know all the basics on IPC as they are undergoing their pre-graduate training. And for the second indicator, healthcare-associated infection surveillance, like I said, the foundation has been built. We have developed a national action plan, which now needs to be finalized and operationalized to start doing the healthcare surveillance within the healthcare facilities. And ideally, it would be to start with the priority facilities, secondary, tertiary facilities, and do initial surveillance, and then you start the implementation. Then for healthcare, that they had a score of 2. And for safe healthcare environments, the score was 1. And we are yet to develop as a country the national standards for safe environments in healthcare facilities. And the priority action will be to develop a national standards for safe environment in healthcare facilities. And this will be a collaborative approach with all the relevant sectors who are involved in infrastructure development and the rest to support in this implementation of this key priority activity. Then the second one was to revise and update the IPC M&E framework to include the new tool for assessing facilities, which enables you to assess the primary, tertiary, and secondary level facilities. Next slide. Thank you.
Thank you, Tendai. So we move forward to risk communication and community engagement. I give the floor to Vichelle and kindly ask her to introduce herself.
Good morning, everyone. My name is Vichelle Harris-Lake. I work for the WHO Country Office in Liberia, and I support the RCCE technical area, the lead. So as we all know, RCCE is a very critical area of work, and it cuts across all the different pillars. And to really get the RCCE going on involves multi-sectoral coordination. So for RCCE, the country has done a lot of good work. However, like I mentioned, there's a need for more collaboration between all the relevant sectors and strengthening the systems, especially at the subnational level. So during assessment, we had 3 main indicators that this area was assessed, looking at the entire RCCE systems for emergency. Under this area, the country have a score of 3. Looking at risk communication by itself, the country also scored 3. And for community engagement, the country had a score of 3. So having gone through all the documents shared and rationale provided by the country team, we've settled on the following priority actions. Number 1 is to empower the subnational level for promotion of ownership and to sustain coordination for RCCE, especially on the One Health approach, which I mentioned in terms of multi-sectoral coordination. To scale up infodemic management at the subnational level to additional states. We already have it going on in some of the states, but we need to scale up that to additional states. And to sustain capacity building for message co-creation and RCCE competencies at all levels. Next slide, please. There's a need to advocate for a dedicated budget line for RCCE activities at all levels. And we need to scale up the use of participatory approaches in terms of social behavioral research, our feedback mechanisms based on our RCCE interventions and strategies at all levels. Thank you very much.
Thank you, Vichelle. We go to the next technical area, points of entry. I give the floor to Buba. And there are 3 left, ladies and gentlemen, and it's already 10:30. And we also want to give a short feedback from our field visit. So please be short.
Yes, thank you very much. I already introduced myself, so we go straight to the point. At the points of entry, for core capacity requirement at all times, the priority areas are integration of POE into radiological and chemical surveillance system. This is in connection to all hazards. We're doing very well in biological aspects, so the radiological and the chemical aspects need to be worked on. Cross-border collaboration and One Health should be emphasized. Improve cross-border collaboration and data sharing as well. And also review and update port health services and guidelines, and then train staff using multi-sectoral approach. But after the visit, we unanimously agreed on some key priority areas that will make the good work going on now to be much better next time. So we will do that after. So here with us. And discuss 4 for one, and then POE2, the score, that is public health response, is 4, and then the risk-based is also 4. Thank you.
Thank you, Buba. And you can keep the mic because the next technical area is chemical events, and you were the co-lead on chemical events. So I introduce you again as the lead is still traveling.
Okay, thank you very much. So for chemical events, mechanisms to establish functioning for detection and responding to chemical events. The priority areas are to establish an effective policy institutional regulatory framework, which is very key, and the score is 2. Also to improve and harmonize existing public health surveillance system to include chemical surveillance and integrate with poison information services. Also identify and describe priority chemical events. So we believe this could improve our interventions next time. And the scores are 2 for CE1 and CE2. The score is 2 as well. And then the priority area is to develop capacity for surveillance alerts and response at national and subnational level, and also to develop capacities for diagnosis and treatment of chemical poisoning and establishment. Yeah?
Thank you, Buba. This brings us to the last technical area, radiation emergencies, and I would invite the co-lead Vishal.
Morning again. For radiation emergencies, the country was assessed based on 2 indicators. The first one was looking at the mechanisms established and functioning for detecting and responding to radiological and nuclear emergencies. Under this area, the country have a score of 3. The second indicator Okay. May I have your attention, please? So the second indicator is looking at enabling environment in place for management of radiological and nuclear emergencies. And under this area, the country have a score of 3. Priority actions are, number 1, to collaborate with NCDC and the Federal Ministry of Health to train human health workers on medical response to nuclear and radiological safety and security-related emergencies at the designated 6 hospitals located at the geopolitical zones. The second priority action is budgetary provision for the National Nuclear and Radiological Emergency Plan to be operationalized. Next slide, please. And to improve collaborations between NNRA and health-related MDAs for planning and implementation of related activities. And lastly, is to create opportunities for testing relevant policies and plans, emergency preparedness and response plans through simulation exercises in the absence of real nuclear and radiological incidents. Thank you.
Thank you very much. So this is it, ladies and gentlemen. And we will have to think about the next steps. We also would like to give a short overview of the field visits, but now I turn to the moderator because I do not know if there's time. I would suggest that we are skipping now for the plenary the discussion or the overview of the field visits. I can tell you in general that we had excellent field visits. That what we saw will be part of the reporting, so you will read it back in the report. At this moment of time, I think, Mr. Moderator, we need to go for a tea break, isn't it?
That's the meeting. We're trying to find out whether... All right, with the permission of the team lead. So good morning again, everyone. So we just want to quickly check if we have any feedback, any comments, maybe from our national observers, partners, based on what the final submissions are put to us have been. Any comments? Okay, Dr. Shelarina, please.
Thank you very much. I want to first of all thank the team lead and the members of the external evaluation team for giving us this summary. I think having sat through the first 3 days in terms of the engagements with each of the technical area and some of the robust conversations around the scoring and priority actions, I think it's quite instructive to sit back and see that the scoring generally seemed to be in line with what the country had sort of assessed itself. But I think more importantly is looking and listening to the priority actions. I think the focus of those 3 days in really looking at the priority actions has come out in this feedback. And I would hope that, and look forward to the priority actions that have now been jointly agreed with your own recommendations, that this will now really turn into very verifiable and actionable actions for the next 5 years. I think also I'll be looking forward to your reflections on the site visits, because again, I assume that some of the experiences during your site visit also informed the final reports that you've given us. And of course, again, maybe in giving us your review of the site visits, if there are other things that you have observed in terms of improving that is not necessarily included in this report, it would be good for us all to also hear of it. Overall, it's been a very interesting and very engaging and a learning event. And I'm hoping and I think that everyone who's been part of this exercise has learned. And that learning will be taken forward. Thank you.
All right, thank you very much, Dr. Shelarina. All right, that's well noted. Are there other comments? Okay, let's get to the national observers.
Okay, good morning, everyone, and we want to write on the comments made by Dr. Haruna, just to underscore the fact that it's been a good learning experience for all of us, and the scoring actually has also reflected, what actually had been done and the tremendous progress that has been made by the Nigerian team. But we must not lose focus of the fact that these are average scores and may actually mask some of the details of the functionality that needs to be taken on board. So even while we go on to celebrate these scores, we should understand that the priority actions are the most important for a sustainable trajectory. And if listening to the presentations, we've also come to realize the quantum of information and improvements and best practices that are inherent across the sectors. So we think that it's an opportunity for co-learning in terms of the jottings that many of us have made. I think we need to go back to those so that we can see what other sectors have been doing in a spirit of One Health approach and learn how we can improve what we do. And more importantly, like has also been said, the elaboration of the mechanisms for collaboration, coordination, and also the mechanism to be able to track down to the subnational level and make sure that what is being done at the national is replicated at the subnational level. Once again, we are very happy that you invited us to be national observers, and we thank the DG NCDC for inviting us, and we think we'll take on board all these lessons to ensure that Nigeria is completely prepared for health emergencies. Thank you very much.
So we thank you very much also the national observers. I'm sure when we get to the closing formalities, more appreciation will be provided to everyone. I think that will be possibly all for now. I couldn't spot any other hands. So Dr. Hank, that may be the end for this section. And if we have your permission, you may want to close the section, then we can be on break.
Yes, may I thank the distinguished audience and specifically the observers for giving your comments and for thanking us, and we would like to thank you so much. This is a joint external evaluation, and we were part of your process, so we thank you very much for that. As you can see, the slides are not there anymore, but there will come next steps. A report will come, and it will be sent to you, and then after final consensus, this report can be read on the website. For now, I close this session. I ask kindly to the moderator to tell us when we have to come back for the final session, where I will give my overview and also on the general recommendations. So not anymore on specific scores, not anymore on specific priority actions, but more general recommendations. Thank you so much. I give it to the moderator.
Thank you so much. Let's put it together better for all the external evaluators for doing great justice, absolutely, to this exercise. The country remains grateful to all you have done. So moving on, we will now be having a short break, so we get ready for the closing ceremonies, where the additional details and other things we need to have will be shared. And at the closing ceremonies, we're expecting to join us other dignitaries, head of ministries, departments, agencies of government, and other parastatals. And so we will be doing these for the next 30 minutes, so as to give us room to also get the hall and everything we need to do ready. So we'll be breaking out, we'll be back by 11:15. 11:15 will be the time to reconvene in the hall. And I'd like to please appeal to us ahead. For the closing ceremony, of course, we know we're all very important dignitaries. Please, it's not going to be comfortable to keep having the noise we're having from the rear side of the hall. It's a lot of interference, and it's not really helping. So we appeal to us, please, let's keep the conversation at the minimum level of volume, if at all we need to keep discussing during this section, so as to avoid other things that we have mentioned. Okay, on behalf of the team, tea served. Good morning. you so very much, distinguished ladies and gentlemen. I'd like to call the meeting to order. Please, can I kindly request that we make ourselves comfortable by getting seated? As we commence the proceedings for this closing ceremony. Please, the movement needs to be reduced now. Let's get seated. All right. May I kindly request that we, as we formally start the proceedings, we take the national anthem, the second stanza of the national anthem, which serves now as our official national prayer as a country. May we please rise to our feet. Thank you. The national anthem, please. Apologies, could be some technical hitch. Are we ready for the anthem, please, or we chant it? Okay, I think we sing it. We are all mostly Nigerians. So it's the second stanza. I'm getting signal that we are ready. Are we? 1, 2, go. O God of creation, direct our noble cause. Guide her, lead us right. Help our youth the truth to know. In love and honesty to grow. And live in just and truth. Great lofty heights attained. To build a nation where peace and justice reign. Amen. Thank you very much. May I please have our seats. We know technology has its own limitations, so we always have our backup. Thank you for your understanding. The Director General, Nigeria Center for Disease Control, the chief host of this event. Permit me to establish the protocols for this meeting by recognizing the dignitaries we have in the hall as we move on into the official closing ceremonies of this JEE, the second edition for the country. We've been joined in this meeting by the representative of the Solicitor General from the Permanent Secretary, Federal Ministry of Justice, here recognized. We have in the room this morning the Executive Director, National Veterinary Research Institute. From the Presidency, we have also been joined by the representative of the National Security Advisor, Office of the National Security Advisor for the country. We have also been joined by the representative of the Permanent Secretary, Federal Ministry of Environment. And we are also joined in this great event by the WR World Health Organization Nigeria office, the representative, the country director also for the US CDC. Also, we have in the room the representative of World Bank here in our midst. Other head of agency here present to recognize very warmly the Registrar Chief Executive Officer, Medical Laboratory Science Council of Nigeria, the representative of the Nigeria Institute of Medical Research, and a host of other top government officials that are also in the room this morning. In the last 5 days, we have had very busy schedule, I must confess. It's been very dynamic, very engaging, very interactive exercise. And this day's event now brings us to the closing formalities also for this. Wherein we will be providing the feedback on the outcome of this exercise so far. And moving on to start with this engagement this morning, it is my pleasure to recognize the team lead for the external evaluators who will be presenting to us, maybe working with the group to bring forward to us the outcome of the field visits, which climaxed the evaluation exercise that we just concluded. And we will be having the field visit report, after which we will bring forward to us the overview of the 5 days activities we've had so far. Then we come back to have what are the priority actions and recommendations from the external evaluators. We take the respective remarks from our dignitaries in the front seat, and it will be a good time to close the section. Shortly after that, we will be requesting those who have been informed or will be informed to join the DG and other dignitaries for the press conference as a outcome of this engagement. We promise to be very short, concise, straight to the point engagement as usual. Distinguished ladies and gentlemen, it's now my pleasure to hand over the microphone to Dr. Henk for the feedback from the field visit on behalf of the team. A better round of applause for Dr. Henk, please. Thank you very much.
Excellencies, distinguished dignitaries, representatives of public, private, national and international agencies, departments, ministries, national advisors, distinguished observers, my colleagues from the external team, I would like to start with giving you, on behalf of the external team, our sincere condolences with the death of 36 army personnel. They defended your security, and we are feeling deeply sorry for you and for your country. They defended your security as you are defending health security. And we have gone through an intensive week of evaluating together with you what are your strengths, what are your weaknesses, what are your challenges. And I will come back to you with some general recommendations. And these general recommendations come from our intensive discussions on 19 technical areas. And we presented them all in detail this morning. This took a long time, too long for you with your busy schedules. But we presented it to the audience, and we will also present it to you in a report, which will be sent to you within 2 weeks, and finally will be reported on the WHO website. Because we are all transparent, all members of WHO are transparent in our health security. The security of you is also the security of your neighbors. And the security of your neighbors is also your health security. We had discussions in this room, but as you have discussions on your ministry, and I will come back to this in the discussion about recommendations, it is all about implementation. And therefore, a key part of this week were our field visits into the field to see if what we were discussing here is happening in the field. Therefore, and also because we have a limited amount of time, I would like to introduce to you the team leaders of the 5 different field visits, and they will give you some feedback, but specifically about what they saw. I would like to ask to stand up Dr. Buba, to please introduce yourself very shortly to the audience and to give a short impression of your visit to Lagos. Is it possible to have a microphone to Dr. Buba?
Okay, thank you very much, Hank. Good morning, all of you. Just to go, can I pass? Just to give a little bit of feedback as to our field visit, we realize a lot of work is being done at the various areas that we visited. At the seaport, and also international airport. We look at the documents, they are available. We discuss with the team members, and then we come to consensus, realizing some little gaps that we felt when they are worked on. The next time we come for G in Nigeria, there will be a lot of improvement. They are step-down training by WAHO, harmonized curriculum for POE staffs. The plans are on the way to train all POE staffs on this curriculum. We also look at the synchronization of database for all designated POEs. We also look at improved awareness on quarantine services at the points of entry. We also need to look at training or capacity building of personnel at quarantine services. Also to improve the workforce at all levels. If we improve the workforce at all levels, there will be a concerted effort for a better resource. Also, we need to look at the isolation facility to improve with MOU with referral system. So they need to improve on the isolation center at the airport, and also so there should be an MOU with the referral system. That will make the system work. So that whenever there is need, they will all have the knowledge and the felt need to act fast. At the state emergency operations, there is need for written protocol and guidelines for interagency collaborative operations. At the level of laboratory, there is need for capacity building, particularly for genomic sequencing, bioinformatics, and biostatistics. So if we have this in place, there will be a lot of improvement. Thank you very much.
Thank you, Dr. Buba Manjang. Dr. Buba Manjang is the IHR focal point of the Gambia. And now I would like to give the floor, and I kindly ask you to introduce yourself also shortly, Dr. Catherine, who was in Port Harcourt.
Thank you very much. So me and my colleague, we went to Port Harcourt, and we went there and we went to see the EOC and the healthcare facilities, facilities. So our feedback is we're happy with everything that they showed us, or the explanations that we're getting with regards to the EOC establishment, management, and everything about this EOC. It was good. Indeed, there was Dr. Golden and his team. They were wonderful. They managed to make us see all the requisites for IHR EOC requirements. So Mr. Golden and his team, we want to thank him for what he did when we were in Port Health. We also went to see their training facilities. That one is especially the ICU, the ICU for infectious diseases. That one is it is a state of the art. The capacity to conduct renal issues, like they were telling us that now they have the capacity to do renal, that transfusion and those surgery, to get a donor with a kidney donor and then fix the other person. So that's in Africa, it's something that we're saying, wow, this is good. So in Port Harcourt, there are things happening. We also went to see from the primary health care, the immunization processes, how they're doing the immunization. We're also convinced it's being done, though work in progress. There are some gaps that they need to address. And also the cold chain facilities that they have. For whatever they're doing, it's actually giving them a platform to be able to attend to issues of that nature. But as the visiting team, we hope maybe there's need for involvement to upgrade that facility, especially the cold chain equipment. There's need to probably attend to that and also assist Mr. Golden and his team in Port Health with operational maybe budget for them to actually operate the facilities there in Port Harcourt. So those were the areas that we managed to visit, and we are happy. We were convinced, just those areas that I've mentioned, that they might need help and assistance so that they can take up their duties. Again, before I sit down, I want to thank you, Nigeria, for the warm welcome. It was my first time to come to Nigeria, so when I come here in Abuja, the welcome was good. You know, you managed to make me feel very important. Thank you for that. I also went to Port Harcourt, and it was the same. And I'll tell you what happened this morning. I sent a photo of me at the airport, and I was saying to my family group, me checking out of Port Harcourt, and my family in that group, they were saying, oh, you look good. Like the picture that me had and my family had about Nigeria and Port Harcourt, it's different from what I experienced. I don't know what they were expecting to see me out of Port Harcourt, but they were happy. So thank you, Nigeria.
Thank you, Dr. Catherine. And you forgot to introduce yourself. You are reaching a weak link, but you are from Zimbabwe, and maybe you can introduce yourself shortly.
Okay. Oh, sorry. All right. My name is Nyamazana Catherine, and I come from Zimbabwe. I'm a public health officer. Thank you.
Thank you, Dr. Catherine. The third who wants to report, I would like to ask Dr. Geoffrey. Please introduce yourself shortly and give a short impression.
Thank you, Hank. My name is Geoffrey Jagero. By training, a microbiologist with FHI 360 Nairobi, Kenya. I'll try to be short. Myself and my team, we visited yesterday the National Reference Laboratory. First, I want to thank the Nigerian team who received us for their warm welcome. We were able to go through very many departments, and I remember we literally had to be pulled out of the place because they had so much to show us and to demonstrate the capacity that Nigeria has. So thank you very much, the national team. We were able to go through the biorepository area, the waste management systems. They showed us the commodities management for diagnostics, equipment for diagnostics, the human resource, some documents as well, and we looked at the area of coordination. I'll try to be a bit brief because these are so many areas that were covered. So there is a very good system for healthcare waste management, which is a challenge in many African countries, and they have an excellent equipment that is handling that area. Our recommendation was just to work towards networking that service so that, because it's an expensive investment, so you simply need to network for that equipment to be optimized. You have a good biorepository system, but it's consuming a lot of energy. Sustaining 80 to 100 freezers every day, 12 months a year is expensive. So we had some recommendations for the national team, which we believe is sustainable and will help the country move forward in terms of not just readiness, but also response. You have at the National Reference Lab an excellent, top-notch diagnostic equipment. Some of the things, the equipment that you have there, some people just dream of or they see on TV. What we would wish to recommend for Nigeria is to optimize the use of those equipment through multi-disease testing. Utilize the available equipment to test for several priority pathogens so that you maximize on what you have. On HR, you have fairly trained human resource capacity at the national level. We don't know what's happening at the state or the local level, but there was a recommendation to enhance the capacity on bioengineering, which, given the expansiveness of the country, probably would help move the country forward in terms of services for biomedical service, for biomedical equipment, servicing and maintenance. Despite all these achievements and positive things that are going on, remember, our visit was at the National Reference Lab. We were not able to visit the animal sector. And so we drop in the word coordination. Coordination, coordination, coordination. With all the gains that are being mentioned within the human health sector, if you don't share those gains, if you don't pull up our brothers and sisters from the animal health sector and the environment sector, we may not achieve much even in the next JEE because you are evaluated as a country, not as a lab within one sector. Again, thank you so much for your hospitality. It's been great visiting Nigeria.
Thank you very much, Dr. Joffrey. I would like to turn to Dr. Richard Garfield.
From the U.S. Centers for Disease Control. We visited the ICC, and I'm still not sure what it stands for, but it's about coordination. Incident Command Center, very good. Thank you. I had visited that center 6 years ago in the first JEE, and it was just getting started. We were sort of helping from US CDC to establish the information sources. Today, there is a plethora of information sources there. And you're in the modern world in that we have too much information and have to narrow so we can find the really useful information. That's a wonderful challenge because the information sources and the presentation of the information there is rich. The opportunities for coordination of information look like nothing that existed in the world 10 years ago. And you're right up there. So the question is, how much and in what ways is that information useful to act on? That's where the challenge is. Not in getting it and having the equipment. You know, JEE measures what you can do much more than what you are doing. So we are seeing what you can do. We went then to the unit which does communications, information monitoring within the NCDC, and answering the telephone when there are rumors and concerns. And that is a newer kind of, that's the soft skill activity, which is so essential in the world of information management, communication, coordination with the population. So it's one thing to be scanning the press to see what they're saying. And it's another to answer the phone when somebody says, I heard there's a problem, or I saw a child with a rash. And I think they were doing a great job. But there's so much more that can be done there. That's a big area still to develop. And I look forward to the day when in Nigeria, at the central level, you receive that telephone call, and the person says, there's a center within reach of you where they can respond to that and take care of that. So we'll get in touch with them, go there, and then we will get the information back to see how it's going. That will be the whole loop when you're actually able to health security. From there, we went to a primary care health center, which was kind of exciting for me. I entered the field, I guess 30 years ago, when growth monitoring and the health card for children was a new idea. They use it with every child. They fill out the form, they give the mother one, they take the other and keep it in the clinic. That's the way it should be. They were doing it. They do growth monitoring, family planning, counseling in a separate room. They do it, all those things the way we've evolved over the years, the smart way to do it. And they were enthusiastic about their work. And perhaps most important, the leaders of the clinic knew what geographic area they were supposed to cover. They had a book which followed the 11 different neighborhoods that they covered. And they also were able to deal with other people who were not from there. I don't know how much they go out to serve people who don't come into the clinic. We weren't there long enough to be able to help to. That's an important thing, especially for immunization or child survival. But there was one thing we saw in this clinic which was weak, which was IPC. There was not infection control functions in place. So you see a developmental opportunity and need. Programs come down, people are trained, they are implemented with the support of international groups, but Nigerians figure out how to do it, and we're doing it well. But it's not all full, it's not all adequate. There are pieces of the puzzle still to make the picture complete. Thank you.
Thank you so much, Dr. Garfield. The fifth visit was done by me to the abattoir of Karoo. I'm a veterinarian myself, showing the One Health perspective of the JEE. We are working as medicals and veterinarians together. We are breaking down at WHO the silos of veterinary and medical practice. From my background as veterinarian, I could have a good view of what is happening in the abattoir in Karoo. And this abattoir is feeding the capital, is feeding more than 1 million people with animal proteins. And what I saw was, first of all, very professional, dedicated staff. I'm really impressed how they, under quite basic circumstances, try to make the best of what they can do. But they were understaffed. They are slaughtering 100 cows a day and up to 200 sheep or goats. And they do not have enough staff to control every slaughtered animal. So they are doing what they call themselves a holistic control. And they are doing their utmost best. What I also saw was that the level of hygiene is very basic. The slaughter process takes place on the ground. Basins are filled with water, but these basins are only changed once. And the washing of the carcasses takes place all in the same water. What I also saw was that there was no respect for animal welfare. I think I touch a sensitive issue. And I can understand this. How can we talk about animal welfare when the welfare of human beings in this country is also basic? I can fully understand this. But I have to say to you that not only animals are living creatures, but also that when you have more animal welfare, you have more production. A cow that you are treating well is producing more milk. Chickens that you are feeding are producing more eggs. And a sheep that you are slaughtering and you are not beating too much, the meat is better. So not only out of the respect for living creatures, but also out of respect for the economy, for productivity. This is what I saw. A third thing, and you will start laughing again, there was no respect for the environment. Not by the staff. They tried to do their utmost best. But the waste basin, they started to build, the building stopped because of underfunding. And all the waste just goes into the environment. If you combine this, if you know that you have anthrax in this country, if you know that there's salmonellosis, this all goes into the environment. And if you then imagine that this is the slaughterhouse for the capital of Nigeria, I can sense a priority action. So this, ladies and gentlemen, was our impression, our feedback from the field visit. On behalf of my colleagues, I would like to thank all of you who made this possible. And I would also like to thank you for your transparency. I would like to thank you for your openness. With this, I want to move forward, but the moderator is coming in.
No, I want to be sure. Are you making the next presentation? I don't know because we are not.
Okay, so this was the overview of the things. For now, I give the floor back to the moderator.
So we understand the issue with animal welfare. And we'll work on it. It's been a very tedious engagement, I must tell you, very strong engagement at the field visits. It might interest us to know that the team left late Wednesday night, for those who traveled out of the city, worked all day on Thursday, joined the next flight again back late at night yesterday, and they're all here bright and early this morning. Some even flew in directly from Port Harcourt this morning, and they're straight back here for the business. I think they deserve a better round of applause for this great engagement. Dr. Henk and team, we can't thank you enough. Thank you so much for the thoroughness and the in-depth work done. So it's been 5 active days of great work, and especially for the benefit of the distinguished dignitaries that are just joining us, it's now time to bring us up to speed regarding what has transpired in details as much as possible in the last couple of days. It is now my pleasure to welcome the IHR focal point for the country, who will be walking us through this presentation. Your Excellencies, very distinguished ladies and gentlemen, please let's make welcome Dr. Oyeladun Okoromade. A round of applause for her, please.
Okay. Good morning once again. The PS, Ministry of Health, the PS representative, Solicitor General, Director General, Nigeria Center for Disease Control and Prevention, ED, MVRI, all other dignitaries on the high table, all protocol duly observed. Can I have my presentation? Okay, and ladies and gentlemen, so I'll be giving a brief overview of what has transpired in the last 5 days, and before we go to the priority action and the next steps. I remain Oyeladun Okoromade, the head of Surveillance and Epidemiology, Nigeria Center for Disease Control. Just to give us a brief overview of the JE as well as the IHR. IHR, as we know, is a legal framework that gives guidance on capacities that member states need to develop so as to build a resilient health system and have a robust national health security in place as a country so that we'll be able to be well prepared and protected, as well as have resilient build in the face of any public health threat or incident that can have any negative health consequences in the country. And one of the framework to ensure that the IHR capacities are well assessed and monitored is known as the Joint External Evaluation. The JE offers an opportunity for the identification of the most urgent needs within the health security system of any country. It measures the national status, the progress in achieving these IHR core capacities, and allow countries to discuss the most urgent capacity building need within their health security system as a country, and inform the development and revision of National Action Plan for Health Security. It helps to prioritize opportunities that will enhance preparedness to prevent, detect, and respond to public health events. It also supports priority investment in health security through domestic and external resource mobilization. It helps to build trust and foster transparency, as well as an opportunity for continuous learning, mutual accountability between the national government as well as partners. In interpreting the JE scores, we all have the JE tool. It has a total of 56 indicators across 19 technical areas, which has been assessed in the last 5 days. Across these different technical areas, as well as indicators, we have 5 scores for each indicators, which cut across no capacity, which is 1, limited capacity for 2, developed capacity for 3, 4 for demonstrated capacity, and sustained capacity for 5. For 1, no capacity means the attributes that is being measured is not in place in the country. And 2, limited capacity means the attributes is in the developmental, is in place, but not yet achieved or not yet commenced in terms of implementation. For developed capacity means the attributes in place, however, is not sustainable and has not been included in the national funding sources. For 4 means demonstrated capacity, that the attribute is in place and is sustainable for a few years and is already included in the funding source for the country. And 5 means a sustained capacity that is functional and there is capacity to support 1 or more countries in the implementation. For the purpose of the JEE, a technical area can advance to another level of score only when all the attributes of the current capacity is achieved. Some responses require documentation, which provide evidence to evaluate the level of achievement, which fostered the need for the field visits yesterday to ensure that the documentations are in place to complete the indicators. Following the 2017, Nigeria conducted the first JEE in 2017, which shows Nigeria was not ready. In total, we had a score of 39%, which shows that the attributes was just being commenced at the developmental stage and not well established as a country. Following 2017 JEE, we've gone through a lot of implementation stage. Looking at the milestone from 2017, in 2019, the recommendations from the 2017 JEE were developed into the first National Action Plan for Health Security in 2018. And following this, there's been a lot of activities rolled out to ensure that we bridge the gap for the 2017 JEE that was conducted. Following that, we've deployed SOMAS, which is an IDSR to all 774 local government area in the country. We've inaugurated the One Health platform, and we've rolled out the One Health strategic plan since then. We developed the Subnational Emergency Preparedness Capacity Building Project to ensure that we foster a lot of capacity building at the subnational level. And since then, we've been conducting a resource mapping for health security investment in Nigeria, looking at the different donor landscape available for health security in the country. And in 2023, here we are conducting the second joint external evaluation to further look at what are the remaining gaps within the health security that we need to further work on. In the last 5 days, we've achieved the following. We've assessed the status of implementation health security capacity using the Health Security Assessment Tool 3.0. We've been able to measure the progress across the 19 IHR core capacities to set new benchmark for the development of implementation plans and roadmap for action. This is to establish a new baseline for health security preparedness and response. We've identified priority actions across various technical areas, and we will use these recommendations for the assessment to inform development of the National Action Plan for Health Security 2.0 moving forward. After this, we'll use this to commence discussion to inform resource mobilization, preparedness planning, and development partners. The progress made from 2017 to 2023. In 2017, we had a score of 39%. And in 2023, this is where we are now. Ladies and gentlemen, This wouldn't have been possible without our collective effort in building the health security across all the thematic areas. It's important to know that we did not score below 50% in any thematic area. Dr. Ank will be giving us more detailed scoring across each technical area, but in summary, this is where we are, and we wouldn't have achieved this without you all. We'd like to say thank you to everyone that's been part of this journey. Thanks.
It is deliberate not to make any comments after she has spoken. I want us to actually sink the understanding of the progress that we have collectively made. Permit me to inform our external evaluators, as we said earlier before now, that in Nigeria there is a way of classifying grades for secondary education. That if a student of secondary education scores anything below 40%, that's fail. I think it's also most in many places. And from there, you're able to move on the other grades. To have a credit is from 50% and above. 40 and above before 50 is pass. So for a country to have moved from fail, which is 39%, great, to a credit within 5 years, I think this country deserves a better round of applause for this great feat. Worthy of note also is the comment by Dr. Ladun that in all the thematic area, there was none that we had a grade less than 50%. Congratulations, Nigeria. So far, so good. But it can only get better. Thank you so very much, Dr. Olado. A round of applause again for Dr. Okuromade for all the great job, for the leadership, and much more importantly, to all the partners, stakeholders who have been part of this. But I'm sure my DG will have a better way of saying thank you when it's time. But now, let's get back to Dr. Heng, the team lead. For some other areas, looking forward into the next 5 years, what are the things we need to now pay more attention into? Your Excellencies, distinguished ladies and gentlemen. Let's welcome back Dr. Heng to the microphones.
Thank you, Mr. Moderator. Okay. Excellencies, distinguished dignitaries. First of all, congratulations. It shows really that we as an external team were impressed by your progress. But maybe you know we had wonderful African food this week, but there is another part in the world, in China, where they have very famous food, and this is sweet and sour. Maybe you know this. So you've heard the sweet, and now comes the sour. It's my role, excuse me for that, because you're not there yet. We come to the scores and we come to the recommendations. Excellencies, you are among the ones, due to your busy agendas, who were not the whole week in this room. But those of you who were in the room know that every day, on almost every technical area, I emphasized that this is about the recommendations. It is about the priority actions. It is not about the scores. But as Africans like sport, like all people in the world like sport, it is also a kind of a sporting game to look at the scores. So I will not go in depth in the scores. I will go more to the recommendations. But I cannot go without the scores. And what is the most important is the general overview. The fact that you went from 39% to 53 or 54%, that is really the gain. But in all the different indicators, as there are 56, I would urge to the decision makers, because I know that will be the first that you will be doing. You will ask your secretary, tell me what was on indicator 3.2, the score 5 years ago, what was the score in the medium term, and what is the score now? And then when the score goes 2 up, it's promotion, and when the score goes down, I do not know what happens. But don't do this. WHO, and I'm the senior advisor to the Global Secretariat, we always say it is contra-indicated to compare the scores. Why? First, because the external team from 5 years ago was another team than the team that's sitting here. Second, the national team that was sitting 5 years ago or 6 years ago in the discussions was a different, I think, for 80% than it is today. So we are not talking about quantitative scores, we are talking about qualitative scores. 3, the tool itself is a living tool. This tool we are using is tool 3.0. The tool we used in 2017 was tool 1.0. And this means that some indicators changed, some indicators went out, others came in. So you cannot one-to-one compare the score of each indicator. Of course, the general impression is that you are rising, and that is why I started by congratulating you. But if you look to the scores, then you can see the red ones are the one with limited or no capacity. And the green ones are the ones that you are really doing well, sometimes even exceptionally well. But there I have to congratulate the national technical experts, because you were tough negotiators. I have been, in a former life, a member of the Parliament of the Kingdom of the Netherlands. I was the chairman of the Foreign Affairs Committee. I had to chair very tough international negotiations. But this week, I had to chair one of the toughest negotiations. I have to congratulate you with that. On the other hand, you showed realism. And several times, when your national team was proposing a score that they wished to get, but was not realistic, it was not us that had to say this, it was you yourself who were saying in your comments, this is not realistic. So this was making our negotiating a bit more easier, but still, they were tough. And these are the results. And I will take some out to discuss, not all, because we did this morning already in detail. And you will get the reports back from your staff. But take, for example, gender. Gender is a new technical area. It was not in the JEE 2017. And your staff was very realistic. They were saying this is new and this is an area we have to work on. We have to implement it in legislation. We have to do this. So I would like to applaud the technical staff for gender equity. And that they were realistic, it was good. You know, this is what we need to do. We need to applaud the technical teams who scored the lowest, because they have the toughest jobs. If you take another, if you look at AMR, AMR is a very important topic, antimicrobial resistance. It will take more people dying from antimicrobial resistance in 20 years than will die from malaria. So it will be the death cause #1. And this is a slow killer. So it is not like COVID, but in a way you could call AMR already the next pandemic. Well, this score shows that the source of the next pandemic will not be in Nigeria. Good. I move forward, and here you can see, and we are still in the chapter of P, and P means prevent. We are building this JEE up under technical areas on prevent, technical areas on detect, and technical areas on respond. And in the prevent, you can see some very interesting thing. Take immunization. It was led by Dr. Richard Garfield. You can see that you are scoring exceptionally high on 2 indicators: national vaccine access and delivery and mass vaccination for epidemics. You are scoring almost the top of the world, a 4. But for a vaccine coverage of measles, you score a 2. How is this possible? Then you have 2 4s and then a 2. How is this possible? This shows the interaction of the technical areas. This is caused, for example, by a lack of communication. We all know there's fake news about vaccination. More and more people don't want their children to be vaccinated. So we need advocacy, we need communication. It also shows that the infrastructure needs improvement. There's not in all the rural areas a possibility to access people and to give them their vaccination due to understaffing, due to lack of cold chain. So there are a lot of reasons behind this. And Dr. Garfield mentioned this technical area, an X-ray of the whole health system. And this indicator 8.2 is also giving a percentage of the people that are vaccinated, the children that are vaccinated. In Nigeria, it is too low. It needs to go higher up. I really hope that in the next JEE, there will be 3 4s. We move forward. So from the prevent, we are now into the detect. And here you can see there is no red anymore. This is good. In the detect, on the surveillance, on the human resources, on the national lab system, you have good scores. A 3 is more than average. And you even score a 4 in the surveillance, event verification and investigation. So this, you really made progress. You are making progress in the detect. But that doesn't mean that you can stop and doing nothing. There is still a lot to do. We were focusing mainly on the human health sector. There is also an animal health sector. And the surveillance in the animal health sector really needs some more funding and some more staffing, some more resources. We are moving from the detect to the respond. How is Nigeria responding to a health emergency crisis? Here you are scoring 2 4s for Public Health Emergency Operations Center. And it was mentioned before, you really did a good job in the last 5 years in rolling out this not only at federal level but also at state levels. You really did it well. But you can see there is still also some red in this. And I really think that this is showing where the gaps are. Of course, you will look at this in detail. You will look at the priority actions that we propose beyond this. But this is how the scoring goes. Finally, you are scoring high above average on your points of entry. And I would really like to applaud you for this. This is the core of the international health regulations. If there is an outbreak somewhere, when you need to close your borders, you have dedicated points of entry, and in these dedicated points of entry, it could be an airport, it could be a harbor, everything needs to be in place. There need to be hygiene, there need to be medical facilities, there need to be quarantine possibilities. So this is really good. Then on chemical and radio emergencies, you need to do quite a lot still, but that's okay. That is for the coming 5 years. So, now I come to the most important part of what I, on behalf of the team, would like to share with you. We gave you, for each of the 56 indicators, from 3 up to 5 priority actions. That's too much. Then we are sitting here beyond prayer time, and that's not good. So I want to tell you, I want to share with you, after discussing internally, what came out for us as overarching priorities, as overarching recommendations. The first, and it was mentioned before, it is that you need to create a 5-year risk-based national action plan for health security. You will do this, I know, but I would urge, do this as soon as possible. Why? Because today, this year and coming year is a window of opportunity for Nigeria. The international funding through, for example, the pandemic fund is open. And when you can now show realistic plans with realistic costing proposals for priorities, then it will be possible for you to get funding out of these international funding. And this you can use for the coming 5 years. So I would really urge you, this is very important to start this, to say next week. A second overarching recommendation is to empower and enable the implementation of the National Action Plan for Health Security. You have to start this, beginning of next year, 2024, to address the gaps in health security identified by the JEE, also by the lessons of the COVID-19 pandemic and by other emergencies and disasters. Nigeria has done a lot of creation and adaptation of guidance materials. Agreed approaches have been implemented in most of your areas at federal level. But epidemics start not at federal level. They are stopped at local levels, specifically in remote areas. And you can beat a fire the best as soon as it is started. And an outbreak of an infectious disease, you can best fight at the source. The grand challenge for the next years is aggressive implementation at state level. And you began with this 4 years ago with the initiation of state-level emergency operating centers. This has advanced. Greatly advanced. There are emergency operation centers in every state. But the challenge, according to our team, for health security in Nigeria is also to strengthen surveillance, to strengthen lab work, to strengthen food safety activities, and all the other technical areas within states. The infrastructure for sample transport, for example. And this is when you really start implementing, when you really start doing what you are saying in your plans you will do, this is what will move Nigeria in the next JEE from scores of 3 to 4, and even from 4 to 5. Our third recommendation is to coordinate multisectoral, public and private engagement for national, subnational, multi-hazard, health emergency preparedness and response, clearly aligned to the national disaster risk management structure, strategy and plan. A high level of coordination is needed to make progress in health security. This is everywhere true, but specifically in large and federated states like Nigeria. Since the first JEE 2017, intersectoral coordination at the national level has been established in all sectors. But there are remaining 2 overarching challenges. First, to make that coordination will be more effective by making it more efficient, using, for example, modern communication technologies to reduce the need for frequent in-person meetings. When you have a multi-sectoral meeting with all the states and you ask everybody to come in, that is an enormous challenge. But today it is possible with Zoom and Teams just to stay where you are. And of course, it's nice to travel and to meet each other. But you could do this maybe twice a year and then have every month a meeting in Zoom or Teams. A second part is to reassess participation. Who is participating? To bring in other sectors that have not yet been fully involved where needed. And the JEE helps to point this up in specific fields. We acknowledged during this week the active participation of the Ministry of Agriculture, but not in all fields. We acknowledged the participation of the Ministry of Environment, but not in all fields. And when we talk about health security, we are talking about One Health security. And One Health security is the interaction between the environment, between animals, between human beings. More than 60% of human infectious diseases originate from animals. And specifically in a country like this country, where you have a lot of wildlife, where you have interaction between wildlife and livestock, and close interaction between livestock and human beings. Think of what I saw in the slaughterhouse. It is essential to really involve all sectors. And for example, to build up surveillance in wildlife. Our fourth and final recommendation is to develop an accountability framework and standard operating procedures for intra- and intersectoral coordination and communication, including the security apparatus, including the private sector, and including the civil society. As you will see in the technical area scoring, the security apparatus is there, is highly present, but the coordination with the health security and the agriculture could be more. They scored a 2 for this. I expect, because this is very important, that this will be faced by you. The private sector. Think about, again, this slaughterhouse I visited. Use the private sector to develop in a public-private partnership a new state-of-the-art slaughterhouse for your capital. That could be a possibility. Civil society. The people will be more involved. You need to involve the people as well. You can do this through civil society. You don't have to be afraid of this, you can welcome this. I would like to say something more on staffing. To realize that state-level implementation, more staff with more skill and more experience will be needed. This is a major challenge for Nigeria, where already you have identified staffing shortages and the loss of staff as key challenges today. People you have, but you need to create professional opportunities for them. Nigeria would do well to train, for example, 5 times more FETP staff. But funding, faculty, mentors are not in place to do this today. How to face this great, great challenge? It will require the modernization of training methods, the establishment of many just-in-time training opportunities, the strengthening of career ladders. People who are good, you need to keep in the country. Improvement of their salaries. It will also require a close collaboration with public and private health providers, as they provide the first point of contact for most human health concerns. I would like to say something on finance. The countries of the world are not alone in facing health security needs. The international community has identified health security as key for all of us, and that is the gain of the COVID-19 pandemic. This means that technical and financial support is and will be available for at least the coming 5 years to strengthen health security system, including those in Nigeria. This is your window of opportunity. You are having experience in using this international support, and your skills in this will create, I'm sure of this, many opportunities, depending on your ability to set priorities, depending on orienting your partners to them. Also, depending on your continuation of the fight against the monster called corruption. I would like to say something on research. Nigeria is such a large and varied country that there are always somewhere health security challenges. That is inevitable. These are threats, but these are also opportunities for research, for learning, for system strengthening. The JEE tool is limited in helping in this, because it focuses mainly on summarizing the existing resources available and not on how these resources are used. But that functional activity requires the use of interaction and after-action reviews to see how the resources are and can be used. That is why we have this overall recommendation. The focus on learning from practice is called operation research or implementation research. And it provides the key feedback to improve the use of your resources. If this is integrated into the work rather than a stand-alone activity, it will work. Integrating the implication of these program reviews is your challenge ahead. It is easy to identify bottlenecks that get in the way of doing a better job. But overcoming the bottlenecks, that is what matters. To sum up, as I said before, this coming 5 years is a window of opportunity for Nigeria. And looking back on this moment, 5 years from now, when my predecessor will stand here to report for the third JEE that is carried out, we may well see that this coming period will be the golden age for developing health security in Nigeria. If you step up to do what is needed, we as international community will be there to assist you. Thank you very much.
Very much, Dr. Henk. I'm thinking if Dr. Henk will want to stay standby, because now we want to go into feedback based on this presentation. But I think you can see it's been on your feet for the good part of the week. Maybe you'll be able to provide the feedback from that side so that we don't keep you standing. A round of applause again for Dr. Henk as he makes his way back to the seat. Thank you so very much, Dr. Henk, for those great feedback. Welcoming Nigeria to the golden age of strengthening health security for us as a country. Opportunities ahead. To whom much is given, much more is expected. We're better prepared than ever before, and we are sure to deliver. And for us as a country, we keep saying it can only get better. So quickly, we'd like to have feedback based on what we've had so far, both for the activities in the course of the week and the great presentation again from Dr. Henk, bordering on those key areas of overarching recommendations, or for the partners who just want to tell us their understanding of this process and their commitment to the process. So this is the order, quickly, in the interest of time. We'll only be able to take 3 from our partners, then we'll come to the high table for the remarks of the government's leadership on this regard. So it will just be by a show of hand. So any of our partners who will want to make a remark, we'll just take 3, just with a show of hand, if you want to make a quick remark based on this presentation. Anyone in the room? Okay, we have Dr. Shola Haruna for United Kingdom Health Security Agency from the Kingdom of United. Okay, let's start with Dr. Shola Haruna, please. Then we'll be able to take 1 or 2 more. So any partner that want to make contribution, please, this is the time before we come to the item. Dr. Shola, please.
Thank you, Mr. Moderator. And it's not the Kingdom of, what did you call it?
United.
It is the United Kingdom.
The kingdom that is united.
Yes, and on that note, I'll bring you felicitations for Majesty.
From His Majesty. Excellent. Well appreciated, ma'am.
Thank you. The ask is to give some reflections on what we just heard from the team lead. I think from where I stand, I must also say that the UK Health Security Agency's project in Nigeria is really focused on the international health regulations. And our project is around strengthening the core capacities in Nigeria around the international health regulations. And that's why I feel I do really need to give some thought to the feedback we've just received. I think I'm particularly enthused by the detail that over the 4, I believe it was, the overarching recommendations. I know these are overarching, but I think they really distilled for our country, Nigeria, the areas we really now need to focus on. And I particularly want to underscore his recommendation around starting now. Because now we've heard it, it's still ringing in our ears. We've also, in our various presentations within all the technical areas, I've already identified some of these priority actions, so it's really fresh in our minds. And it's when the iron is hot that you strike. So I'm really thinking that that's something we need to take on board. I'm also pleased with this recommendation that this is an opportune time for us to really be clear about what those priorities are for Nigeria in terms of pulling us forward, pushing us forwards around those very many scores that we have. So being clear, I think, is something else we really need to take on board apart from the urgency. So we need to be urgent, but we need to also do that with a lot of care. I think one other thing that just listening to the feedback, again, which I would also like to underscore, and which there's been some improvement, but we can always do better, that coordination and collaboration. I don't think we can progress without it. It's so fundamental. We've started, but we just need to build upon that. And what has been evident again over the past 3 years is that there are pockets of excellence in different areas that could benefit other areas if only we were much more aligned in our planning, in our execution, in our talking to each other. So that would be the third one in my reflection I would like to underscore. But overall, I think I welcome this feedback. It's very clear, and it will be something to look forward to the much more detailed report. But even whilst waiting, I think there are a number of things that strike chords with I would imagine, people here, which can help us to start thinking as we wait for the report. I want to thank you again for a very interesting week, a learning week, and I hope and think that we still take this learning forward. Thank you.
All right, thank you very much, Dr. Shola. Definitely, we have a lot of learnings to take forward in this regard. We're taking note of those comments, and at the end, if Dr. Henk has any other final thoughts, we will be glad to have them. Okay, resolve to save life, very critical to this progress so far. We'd like to have your quick comment. Dr. Jenham, you have the floor.
Thank you. I want to also continue on the established protocol. And I want to thank Dr. Henk for such a wonderful presentation. And also commend the Nigeria team for the progress from 2017 till date. We saw the improvement from the 39% to approximately 54%, despite the changes in the tool. So I think that is commendable. I'm John Danjuma from Resolve to Save Lives, and we have been working very closely strengthening health security in Nigeria, spread across almost all the technical areas, from legislation, financing, health emergencies, IPC. So it's good to really see the progress that Nigeria has made. But I want to really emphasize what Dr. Henk has said and Dr. Shola around multisectoral coordination and real governance. Right, so apart from the governance at the national level, for us to actually reach that golden age in Nigeria health security that you mentioned, is also important for us to also ensure that these sub-national levels are also carried along. Because for me, from all the indicators that I've seen across the 2.0, 3.0, if we don't have a focused investment or focused strategy for the sub-national, it's likely that the next JE will still be hovering around 2 and 3. Because for us to really advance beyond 2 and 3 to reach 4 and 5, then we have to demonstrate that strength, that health security capacities at that subnational level. So just to end from with what Dr. Shola has said, really it's important for us now to actually start thinking through how we can push forward with all these recommendations that we have seen from this exercise. I want to say thank you and well done to all the teams that have made this day very possible. Thank you.
Thank you very much, Dr. Jenham, for all the great works being done. are very much appreciated. It's looking like we have more from this side. So let's quickly take from the RTI International, Dr. Emmanuel Hoja. You have the floor, please.
Good afternoon, ladies and gentlemen. All protocols duly observed. I am Dr. Emmanuel Oga of RTI International, and we are one of the partners with NCDC in the past couple of years in working towards this, this big achievement of having a joint external evaluation. I want to congratulate all my colleagues across board for a fantastic achievement, for gaining some progress over the JE of the last 5 years. I want to thank the external reviewers for an objective, fact-based assessment of capacity across board. I just want to add my voice to what my colleagues have also said in previous comments, but I also want to emphasize the value of the ability to document our capacities across technical areas. I know in the course of this review, over the past couple of days, there were many instances in which references were made to documents, the existing protocols, the existing terms of reference across different technical areas. And I think one of the areas that can be strengthened in the next 5 years towards the next JEE is that multisectoral ethos of documenting capacity. It is one thing to have that in place, but it's also one thing to be able to show the evidence of that capacity in writing. So I want to add my voice to that critical segment and to once again congratulate you all for a fantastic week for Nigeria and global health security as a whole. So thank you.
Thank you so very much, Dr. Oga. Of course, whatever is not documented is not done. So we look forward to more collaboration in this regard. We are coming to the high table. That's where we have the final says. Sorry, WR, sir. Well, we just want to give the partners and other stakeholders 1 or 2 more. Okay, so let's welcome Dr. Patrick Ngoku for Affinet. Dr. Patrick, please.
Thank you. Let me also join others to congratulate ourselves, but also the external evaluators for a very transparent process of the JEE. I just have a few comments. One, an improvement of 39 to 54, I think is very commendable. But I do note that among the prevent, detect, and respond, prevent was the lowest. I think that's an indication of still the high risk that we face and the medium to low capacity that we need to work on. So that's one point, that prevent was the lowest among the 3. I think that's very indicative of the foundational issues that we still have to invest in and deliberately prioritize. I like the comment about the summative evaluation. I think it would be very interesting to know of the 134 billion that was proposed for the last NAPS, how much did we actually raise overall in the 5 years and annually? I think that would help us with thinking a little bit on how to tailor the advocacy piece. I think the last issue, and I've had WR emphasize time and again, is this nexus between PHC strengthening and health security. And I think there are a lot of opportunities to think, and I like the comments on the immunization technical action in terms of access, but still coverage is low. How do we take opportunities of the National Strategic Plan on PHC improvement and immunization improvement that has a lot of recommendations on how to deal with the misinformation, but also how to strengthen the PHC, because without a strong PHC, health security is is not guaranteed. I think the other thing is the conflict and the humanitarian setting. How do we deal with that? But the other point that I forgot on PHC, I think there's a very good framework on, I believe from FMOH, on the strategic direction on community health. And how do we take advantage of that framework to strengthen community-based surveillance and community-based structures for information, resources, early warning, and those type of things. So that deliberate effort between PHC efforts and health security efforts, and how to deal with the issues of essential public health functions in terms of addressing workforce for UHC. The last point is, now it's Ministry of Health and Social Welfare. What are the opportunities embedded in that nomenclature in terms of strengthening health security investment, particularly advocacy? Thank you very much.
Thank you very much, Dr. Patrick, for the brilliant submissions. I'm sure they're very well noted and will be explored moving forward. I'm afraid we have to come back to the high table now. By the way, I must recognize the brilliant contributions of our national observers in the last couple of days to this great exercise. I think we can make the applause better and richer for them. I've also been reliably informed by the team that they have submitted their formal reports to the Secretariat, but you can be sure they are all good news. Of course, great recommendations to improve what we are all doing together. Again, thank you very much, distinguished academics and national observers we have in the room. All right, so we're back to the high table, and I think the World Health Organization, WHR Nigeria, is eager to give us the feedback on behalf of WHO for the country. WHR, sir, the floor is yours.
Thank you very much. The JAE team, DG, the Director of Public Health, colleagues, partners, my own fellow colleague from WHO. First of all, I would like to join my voice to all who spoke before me to really congratulate you. You've done a great job. I have been part of several evaluations, including the Presidential Health Reform Committee and others, the Presidential Steering Committee on COVID-19 pandemic, and many other evaluations. I could see that through the recommendation, we come across the same areas where we need improvement. Scoring 54% in Nigeria today, using a refined tool, a more qualitative tool. It means that in reality, if we had used the 1.0, it would have been much higher than 54%. So we have to bear that in mind. And to score 54% in Nigeria, such a complex country, a country of contradictions, a country where the polio program is the top of the world, or among the top. And it's another program for surveillance and outbreak response, very well advanced, but coexisting with other surveillance activities that are struggling. The community-based surveillance that the previous speaker mentioned, it's very well advanced for polio. Why are we struggling for other diseases? Why are we having high coverage for polio vaccination and we are struggling for measles? So there are contradictions that need to be resolved. We need to learn on what works already in other programs. And I think there is an opportunity for Nigeria to do better. If there is one thing that we need to think deeply is the coordination, emergency coordination. It's very important that we get it right. Nigeria has an opportunity. It's not about lack of human resource. They are there. But how are we tapping into existing resources to further the agenda of the global health security? So it's really an opportunity for us to take advantage of all those existing reports and this JE report to get a much better, much stronger diagnosis. Now, I would like to advise Hank. I know beyond your presentation, we'll have a more detailed report. I would like to advise you not to wear gloves to tell us what we need to do differently, because we are very diplomatic. We don't need diplomacy here. We need strong actions. That lack of collaboration between animal health, environment, and human health is an important one. We are in a country with multiple agencies dealing with emergencies that may not be speaking to each other. We have NPA-CDA, more focus on polio, routine immunization. We have diphtheria outbreak, for instance, today. And we've seen how we've struggled to get together one response in the country. So coordination is key. I would like to call upon you not to wear gloves. I, as WHO, can wear gloves, but you definitely not. Okay. So otherwise, it's very detailed. I've been interacting with my colleagues who have been part of the discussion. I really want to thank you. We are in this together, and we will continue to support Nigeria to get to 100%. What is needed is 100% to be ready. Now, you mentioned that the plan, the next National Action Plan for Air Security, may target January 2024. It doesn't mean we have to relax, because between now and January 2024, there may be another pandemic. Who knows? So it's very important that in everything we fix, we act with a sense of agency. Otherwise, thank you again for the opportunity, and congratulations again for a great job.
Dr. Walter Kazadi Mulombo is the head of mission and country representative for World Health Organization in Nigeria, and it's been lots of support over the years and the progress we have made so far. If you don't mind, another round of applause for the WR, please. Thank you so very much, sir. We are very grateful. The points are all well noted. All right. A great support has also been received by the World Bank in the course of this engagement. So the last set of commendation or feedback on this regard will be coming from Dr. Michael Olugbile, who will be speaking on behalf of the World Bank. Dr. Michael, round of applause for him, please.
Thank you so very much. Once again, congratulations to Nigeria, and we really appreciate the hard work of the external evaluators and also our national observers. Particularly, let me use this medium to recognize my lecturer, my own teacher. And I'm sure there are so many of us in this hall that Professor Tanimola Akonde taught in medical school. So thank you, sir, for being here. So I think in addition to what everybody has said in terms of where the next investment should be, and then the need for coordination, I want to add the fact that now we are at 54. Nobody is saying this is only government of Nigeria intervention, or it's USCDC, or it's WHO, or it's the World Bank. What we have here is the overall results for all of our contributions. So we need to continue to work together. So we have talked about intersectoral coordination. I want to talk about even within the partners. That's where my emphasis is on. As the world's attention is on health security, lots of resources are going to be invested in health security across. But we as partners, as donors, we need to work together so that we can maximize the available resources. Otherwise, there will be inefficiency in the products, inefficiency in the system, and then we'll not be able to get maximum results for the available resources. So this is a call for us as partners. Others have talked about the government's coordination, but for us as partners, we need to work together. Let's avoid duplication. Let's leverage on our individual strength and capacities so that we can get better results for the country. The next 5 years is going to be great, but we all have a responsibility even to make sure that we coordinate ourselves as partners. Thank you so much.
We all have responsibilities to coordinate ourselves for more effective results. Thank you very much, Dr. Michael Ugwile, and to the World Bank for all you do. Now we go to the government, and it will be our pleasure to hear first from the representative of the Permanent Secretary, Federal Ministry of Environment. It's no other person than the Director of Pollution Control and Environment Health of this ministry, in person of Mr. Charles Ikea. I don't know whether you want to come up. I think you prefer to come up. So let's get the welcome and the remarks from the representative of the PAs. If you don't mind, let's keep the applause sustained as he comes to the podium. Thank you.
The Permanent Secretary, Federal Ministry of Health, distinguished ladies and gentlemen, may I crave your indulgence to stand on existing protocol as I read the remarks of the Permanent Secretary, Federal Ministry of Environment, Alhaji Idris Yusufu. The Permanent Secretary, Federal Ministry of Environment, actually wanted to be here personally to witness this event, and of course say one or two things. However, he has some other official engagements, and so he has asked me to be here, represent him, and read his speech. And so that is exactly what I'm going to do. I'm very pleased to be here today to present these opening remarks as this second National Joint External Evaluation. It is quite commendable for us to witness this evaluation as Nigeria strives to prevent and respond more effectively to disease outbreaks. As part of the obligations to international health regulations, member states are required to develop, strengthen, and maintain their capacity to respond promptly and effectively to public health risks and public health emergencies of international concern. The Joint External Evaluation is a collaborative process for assessing our country's capacity under IHR, and we appreciate NCDC for taking the leadership and responsibility for coordinating this event. Disease outbreaks and other public health emergencies are unpredictable and require a variety of rapid intervention or response activities. As we all know, Nigeria experiences annual occurrence of infectious disease outbreaks, as well as other public health threats, which require us as a nation to develop predictive capabilities before they occur, reduce time to detect, and mitigate the adverse impacts of these health emergencies. Distinguished ladies and gentlemen, you can agree with me that environment plays a key role in breaking the chain of diseases. Hence, the ministry advocates and promotes environmental health surveillance, sound sanitation, and hygiene practices, among others, so as to prevent the occurrence of some of these threats. In a bid to tackle some of these public health challenges, the Federal Ministry of Environment, in collaboration with other stakeholders, developed a national environmental sanitation policy and its guidelines, strengthened the public health situation of the sub-national level by establishing sanitation desks in all the 36 states of the country, including FCT. And these sanitation desk officers are to coordinate environmental health and sanitation, including other related public health activities within their respective states. Not relenting in this, the ministry has also established a Center for National Integrated Environmental Health Surveillance Program for continuous systematic collection, analysis, and interpretation of environmental and public health related data needed for the planning, implementation, and evaluation of public health practices. The system is expected to provide and share data that could alert the human and animal health sectors to plan and prepare for any outbreak of diseases. It is my fervent belief that with the identification of the gaps, opportunities and recommendations from the 2023 Joint External Evaluation, the ministry will prioritize its opportunities to enhance and improve its preparedness, response, and actions required for the international health regulations implementation in Nigeria. In this regard, I wish to urge every sector actor to commit to seeing that there is a tremendous increase of our score going forward. We appreciate every sector, MDAs, and development partners, especially NCDC, for your active participation in this event. Thank you, and God bless you all.
Thank you very much. Thank you very much, sir. Thank you so much for the great support and the contributions from the Federal Ministry of Environment moving forward. And our special regards to the Honorable Pamsek and the incoming Federal Minister of the Ministry. All right, I'm asked to announce to us that we are just 30 minutes to Jumat prayers, and in that reason, we will be taking very short remarks now, if you don't mind, for our colleagues to be able to go for prayers. So let me come back to the Executive Director, National Veterinary Research Institute of Nigeria, in person of Dr. Miriam Muhammad, who will be giving us the remarks, the feedback, and the comment. Do you want help or you have comfortable here, whichever one is? It's fine here to save time. Thank you, ma. A round of applause for the HED, please. Thank you so much.
Thank you very much. I'd just like to join my voice to others that have congratulated both the national and international teams for the hard work that has gone into this exercise. Just speaking from the animal health side, I think the reaction we got this afternoon talking about animal welfare is what is very typical about us in Nigeria. And I think the time has come that we need to understand that human health also is dependent on animal health and on environmental health. And if one leg is missing, then health security is in danger. And just to also agree with the WHO rep that please put all the gloves off when you give the final report, and to talk about the importance and what you have seen on the animal health side. Unfortunately, the team was not able to visit our lab in VOM. I'm sure that would have improved also the scores for laboratory diagnosis, because there's also been a lot of improvements there. But just to add voice and to say that there is a need for us to improve the infrastructure around animal health so that we can secure human health.
Thank you very much and congratulations.
Thank you very much, Executive Director Dr. Maryam Muhammad, for all the great job. Next, asked to take quick remark again from the representative of the Solicitor General in the House, and that's the Director, International and Comparative Law Department, Federal Ministry of Justice, Mr. Nana Hebo. Your Honor, sir. A round of applause for him, please. Thank you. Or do you want to go up for the cameras?
I don't. Let me.
Yes, I think it's better. Apologies for the time. So it's an address, so it's better to be made formally from the podium. It's a written address. My Lord, you have the podium, sir. Back to health. Thank you very much, sir.
Good afternoon, ladies and gentlemen. I stand on the already established protocol. My name is Nana Oka Ibom, Director, International and Comparative Law Department, Federal Ministry of Justice, and I'm representing the Solicitor General of the Federation and Permanent Secretary, Mrs. Beatrice J.D. Abba, OON, MNI. I will read her goodwill remarks. It's an honor and privilege for me to be part of the dissemination of Nigeria's second Joint External Evaluation Report, 5 years after the conduct of the first in 2017. As a signatory to the International Health Regulations 2005, the country will do all it can to ensure that we align our laws to enable full compliance to implementation of International Humanitarian Regulations 2005. Following the 2017 JEE, the Federal Ministry of Justice has worked with the National Assembly, Federal Ministry of Health, NCDC, and other relevant stakeholders to ensure the NCDC bill, which gave the country the Nigerian Center for Disease Control and Prevention the mandate to coordinate all our IHR activities, was passed into law, as well as the passage of the Animal Disease Control Act 2022. These are two priority actions noted in Nigeria's JEE report 2017. Additionally, there have been new laws that have been passed by the legislature to further strengthen the public health legal framework, such as the Public Health Emergency Bill 2022, the Ports Health Service Bill 2022, the NCDC Act Amendment 2022, and the National Health Amendment Bill 2023, which are all awaiting the assent of the President. It is important to note that recognizing the importance of multisectoral approach and the need to strengthen the subnational levels, the country has involved as many relevant stakeholders, many relevant MDAs and states in the process of reviewing our laws and providing trust to the efforts towards review and enacting relevant laws to enable strengthening health security. Ultimately, these efforts will ensure that we have the capacity to prevent, detect, and effectively respond to public health risks and emergencies. Also, we have consistently supported the development and implementation of the National Action Plan for Health Security. The Federal Ministry of Justice will provide the same support as the external evaluators reveal our score and priority actions, and the NCDC leads the process of developing the National Action Plan for Health Security to bridge the gaps identified from the JE. Incidentally, we were present today and heard about the scores, the movement from 2017, 39% to 54%. That means there is still more to be done by the Federal Ministry of Justice. As the parent ministry responsible for promoting relevant health security legislation, we will remain in the forefront of advocating for and ensuring that the relevant MDAs supporting health security in the country secure all the support they need to deliver on their mandates. We commend NCDC as the IHR national focal point for its untiring efforts that ensured we successfully conducted the internal and external assessments and has presented the result of this all-important exercise, during which our validated scores will be revealed. We remain grateful to all partners for their consistent support through the various public health emergencies, as well as efforts towards ensuring we develop the capacity to prevent and effectively respond to them. We wish Nigeria a successful conclusion of this exercise. Long live the Federal Republic of Nigeria. Thank you all for your attention.
Thank you very much, sir. Thank you so very much. It's gratifying to know the country's position from the Federal Ministry of Justice, in line with our commitment to do all to ensure that our laws align with the international health regulation policies as expected. Thank you very much, sir. We really appreciate it. Now we take the last presentation from the representative of the Permanent Secretary, Federal Ministry of Health, who will be bringing forward to us the speech, the address of the PS. It's my pleasure to welcome the Director of Public Health, Federal Ministry of Health, who will be giving us this presentation on behalf of the Permanent Secretary. A round of applause for Dr. Ayaike, please.
Good afternoon, everyone. Good afternoon, Nigeria. I would like to appreciate the JEE team, the various development partners, the academia, development partners here and implementing partners, the civil society, and gentlemen of the press. Before I go on, you just have to permit me to recognize two of my teachers here, because it is very important to also recognize those that have helped you, even in this journey of the life, especially in academics. Professor Tien Akonde, I must call your name. And then Professor Mojola of Lute. I am making this remark on behalf of the Permanent Secretary, Federal Minister of Health, Ms. Kacholom Daju, who would have loved to be here, but you all know the situation. We are preparing for the incoming ministers. And so she had other things to do, and she had asked me to come and make this remark on behalf of the Federal Ministry of Health. I want to congratulate everyone for the achievement we've made. The journey started in 2017 with, according to our evaluator, he said 39%. That was a red mark. But in the next 5 years, we've been able to get to 54%, which actually is 38% increment. We wouldn't have been able to do that without the contribution of everyone in this room. And as a government, we want to assure everyone that we will provide that environment for us to continue with this journey. And to also state that the government is committed strongly to the principles of One Health. We're also committed politically to ensure that the recommendations from this evaluation will be taken to a higher scale. We are very much aware of the situation in the country, but we must do our best to protect Nigerians. We also know that our health system is built on the principles of primary health care, which, if you look at what we say in the report, the multisectoral aspect must be covered. We must work collaboratively. We must appreciate the support of the partners. So as a government, it's our commitment to make sure we bring every person onto the table, because no contribution is very small. We also want to assure everyone that this time around, we're very strongly moving towards walking the talk. Walking the talk in the sense that we are going to ensure we've looked through the report, we've seen the gaps, we've seen the red marks, and from the comments, even on the prevention aspects. So we're going to digest all that you have done. So all your efforts wouldn't go in vain. And we expect that in the next 5 years, we are going to have a very good trajectory on this report. We are also aware that most of the indicators were just new. They were not the ones we started with. So, in summary, we will ensure that we keep moving at a higher pace as a country. So let me use this opportunity to congratulate my brother, Dr. Adetifa, because if you did not have that effort to coordinate, we wouldn't be where we are. So continue the good work, and the ministry will give you that support. So, on the final line, let me thank everyone, the development partners, the civil society, my parents, my other colleagues in the ministry, and also the JEE for all they're doing, the WHO, the World Bank. And we have also found out that we must not leave the private sector. And so we are bringing every person to the table and assure you that in the next 5 years, you will get a better result. Long live Federal Republic of Nigeria. Thank you.
Thank you very much. Long live Federal Republic of Nigeria. Thank you very much, the representative of the Permanent Secretary, Dr. Chukwuma Ayaki. Thank you very much, sir. Dr. Henk, you've heard from the Nigerian government and our partners. Your closing thoughts in a few minutes, as you've said.
Thank you, Dr. Biodun. First of all, I would like to use half of my 2 minutes to thank you and to thank Dr. Haloon. Dr. Haloon is the coordinator, the IHR focal point of Nigeria. She was my national counterpart. Thank you so much. And Dr. Biodun, nobody is thanking the moderator, but I think he needs a warm applause. Furthermore, I would like to thank for all the kind and gentle comments. They are addressing mostly you yourself, and that is good. There was one comment addressing us, and that was taking off the gloves. I am wearing no gloves. And I will say you the following. Do not wallow in complacency, because 54% means that the average score is 2.7. And 2.7 means Nigeria is still in the orange color of IHR. And orange color means that your scores are not sustainable. So from now on, and I would like to repeat what was said in the comment, you need to start now to go to turn Nigeria yellow. Thank you.
We turn Nigeria orange, turn it green, and it keeps getting better. Another round of applause for this wonderful team led by Dr. Heng. Thank you so very much. In the interest of time, it's my singular honor and privilege, Your Excellencies, distinguished ladies and gentlemen, please make welcome the Director General, Nigeria Center for Disease Control, Dr. Ifedayo Adetifa. And this will be his closing thoughts for this meeting. Thank you very much. DG, the floor is yours, sir.
Well, good afternoon, everyone. Permit me to stand on existing protocol, but I will, of course, appreciate the representative of the Permanent Secretary, Ministry of Health for making it here, and also all of our other representatives of permanent secretaries in our One Health space, and my colleague and big sister, the NVRI director. A lot has been said, and I don't think I should say too much, especially given the constraints in time. So let me start off with appreciations. Obviously, we owe an immense debt of gratitude to our external evaluators. So thank you again for coming and for working so hard, including traveling to many parts of the country in a short period of time. Also, our appreciation, of course, goes to our national observers. I've called them election observers, distinguished academics and subject matter experts. We appreciate you, certainly. Our partners, this is shared glory. It is our score. It's a sum, and I like the way the World Bank representative put it. This is the cumulative, or the representation of our cumulative efforts across board, because health security is an all of government, all of people endeavor. So thank you very much for your support and for working along with us in this journey. Civil society representatives, state public health authorities, please, you have our gratitude. To the fourth estate of the realm, our media partners, the people who make sure that the subject remains on the headlines, continue to reach out to get our opinion or get us to weigh in on things. We thank you. Information dissemination is a big part of health security, and we learned a lot of lessons in that space in the context of the COVID-19 response. I hope that we will continue to work together to amplify matters of national security. We have seen the score, and all I will say about the score is we're glad that it has moved. It represents progress when you are looking at a metric, and that's all I'm going to say about it. Of course, I will say something different when I need to speak to, depending on the audience. Of course, it's very clear, and Hank's summary at the end reflects that. If we assume that there's a 46% gap, that gap translates to risk of outbreak, risk of not being able to mitigate the impact on the population, challenges to the resilience of the health system, challenges to essential public health functions, challenges to PHC, to UHC, and we must now focus on how to address these challenges. This is my takeaway message from here. I'm glad that we can report that the country hasn't been twiddling its thumbs for the last 5 years, but now that that is confirmed and out of the way, the question now is the future. And the countdown is actually on. So from today, we have 2 years to the next midterm review. And personally, I'm in a hurry. I do not intend to reach retirement age doing this job. So I hope to move on to other things and maybe go and conduct JEE in other countries. Or be in the parliament like Henk at some point in time. Anyway, so the countdown is on, and as I said at the close of the external evaluation, if there's anything else that this result, this process, the priority actions and other things that have been said here remind me about, it is the strategic bent that I've sort of proposed that we should all adopt in moving on. All of our actions in the health security space now needs to conform to that acronym SAS. Okay? We need scale. All right? And scale means it doesn't matter what you do in Abuja or in Niger State. All the subnational elements need to be carried along to be exactly as strong as the national body. More importantly, I think that the ambition that we need to have has been set before us. We need to be ambitious. So we need scale, we need ambition in addressing all of the matters that have been laid before us. We need to be innovative. We need to bring technology to base. We need to recruit more partners. We need to think about reaching or having an impact on everybody who lives within the borders of this country. And of course, even in our boundary areas. And of course, we need speed. Okay? Scale, ambition, we need speed. And I've said the countdown is on for 2 years. Our public health events do not operate by our timetable or by our convenience. They don't care whether, we have to write a new 5-year NAPS. We have to mobilize money. No, the next outbreak is probably cooking as we speak. Okay, the next public health event is in incubation as we speak. New variants of SARS-CoV-2 I imagine and being reported everywhere. Are they going to cause us a problem? Okay? I mean, of course, we've got diphtheria. We've got, I saw a message about suspected anthrax, and my heart skipped a beat until they confirmed to me that it was an animal case. Because obviously, a human case then adds another dimension to the challenge that we have. So we need speed. And finally, for our SASS, if there's any time when we need to be strategic, it is now. We need to have a strategic approach to all that we do. We need strategy to achieve synergies. We need alignment. We need to make the best use of the funding landscape in the health security space. We need to make the best use of other sectors that have not previously played a significant role in the health security space. And I look forward to everyone here working with us at the NCDC. Let me qualify that, okay? I know that people understand this, but sometimes understanding can be superficial. We need understanding to reach the spinal level where it becomes just a reflex, okay? This is not NCDC's project, please. The NCDC just has been given a convening, a coordinating role for IHR. All of the IHR technical areas and health security in general require the entire government, require the public, requires communities, requires states. We are just a convening authority because somebody needs to check that we are doing the things that need to be done to make sure that the country meets up with its IHR obligations. And maybe soon, even when the pandemic treaty is signed, there may even be more responsibility. So please, when we come to you, when we ask for representation, it's not our project. We are working on behalf of all of us, okay? And we cannot do anything without all of us. If this is just an assessment of NCDC's progress, like we report to the Ministry of Health or the Federal Executive Council, it's different. We can, we can talk about the things that are exclusively under our purview, and we'll probably score, it will all be green, okay? But health security becomes a different animal because it is touching on every sector of government, from justice, to the environment, from civil society to gender, and equity issues. So please work with us. Let's achieve alignment in strategy. Let's work in tandem so that we can achieve the greatest impact. Time is far gone, and we need to release our colleagues to pray. So I will just close by saying that, there are some clear areas that we are going to immediately start to work on. The development of the NAPS is urgent. It's an emergency. It is late. It should have arrived last week. Okay? So whether we are able to develop a full NAPS in the remaining time of the year or not is left to be seen, but we will aim for that. But as a gap-filling measure, we will come up with a plan, whether it's an annual work plan or a quarter plan for planning for what needs to be done in the next 3 to 4 months. That is a matter of emergency. IHR coordination will now be run from my office to ensure that we have better coordination, hopefully, as I try and interact and work more closely with all of the executives of related health security MDAs to get them on my side so that also we can put more pressure on our permanent secretaries and our ministers to make sure that they also get all of the resources, but are also aware of where they may be performing suboptimally in terms of their contribution to our health security agenda. Certainly, our subnational strengthening priorities will continue, and we will be working with our colleagues in the National Security Advisor's Office and even now at the SGF's office to make sure that we have that high-level commitment that is required to track the progress or the lack thereof in achieving our health security goals. To conclude, the IHR team at the NCDC and all of the technical area leads have worked very hard in the last couple of weeks leading up to the internal and external evaluation phases. And I'd like to commend them for their really hard, selfless work on this subject. Please, you only have the weekend to rest, I'm sorry. The reward for good work is even more work. Okay? So I know that if we say anything now, you'll be, let us rest, let's go and recover. Well, sorry. You have just the weekend. Work starts again next week as we try to a way forward in response to what has happened. But you have my gratitude, you have my appreciation, and you can see the reward for all of the work that you've done in the years in between the midterm review and now. So thank you very much. To conclude, it is a privilege for me to stand here as, the arrowhead for a lot of work that has been done by other people. You know, the JAE score is not about me, as I've said, it's about the country. But it is a privilege to be standing here as the executive of the agency that has sort of coordinating responsibility. And I just want to close by, again, thanking you, one and all, for your contributions to this achievement. I also want to thank, there are many people who should be here. I am glad that, for example, Ms. Ilori, immediate past national focal point and head of surveillance at the NCDC is here. It would have been nice to have also had Dr. Katubo, who is the immediate past director of Public Health Services. I've shared the news with him. He's really happy. A lot of work went into POE from compared to, and we can see the results of the investment and the work in that space. I think it's important that I mention the contributions of UKHSA and others, in particular to chemicals. Because I can assure you that chemicals will probably have recorded a very low score without the sort of impetus that they brought to that. And chemicals are an area of priority for us. We will try and do more there as well. Now, the challenge we're trying to also pick out particular things to recognize is that I will end up leaving out people. So, as they say, when you are in a hole, you stop digging. I'm going to stop now. And just repeat again, thank you all very much.
Thank you very much, Director General.
Obrigado.
Merci beaucoup. Thank you.
Sana, Jerry Chef.
All right. Let's keep it up, let's keep it up, let's keep it up for the DG. Thank you so very much, Director General. Yeah, that sounds more like it. Thank you so much, everyone. A few announcements and we'll be done. Shortly, as we take the closing anthem, the national anthem, after that, lunch at designated places. But while lunch is going on, the hall will be repurposed again to serve for us as a venue for the press body. So you are excused from the press briefing. Those who need to be... Okay, so yeah, so it's still part of the announcement that there will be group photograph. So we take the closing anthem, the national anthem. We move outside for the closing photographs. And then the dignitaries who are meant to be part of the press briefing will be in the hall. And the rest of us will be having a great time together again over lunch, discussing and relishing over these last few days' achievements. If that is all, it's been my pleasure being your host in the last couple of days on this engagement. Thank you so very much for all you have done. Thank you, thank you, thank you, thank you again. And see you and see every one of us in the next time we call us. Group photograph will come after the closing anthem. May I kindly request Your Excellencies, distinguished ladies and gentlemen, that we rise for the national anthem. Please, can we have our audience? The national anthem, please. Congratulations, Nigeria. A round of applause for ourselves. Thank you very much, everyone. Thank you, and God bless Nigeria. Now we make our ways now to the entrance. Let's get outside the building. And there's an open space for the group photograph. Like we did it on Monday. Please let's come out and we will be given the needed guidance on how the photographs will go. Sorry, please, announcement. The group photograph will be done at the garden because of the cars at the park here. The garden is to your right. When you come out of the building, then you turn a right again. Please, let's make our ways to the garden. You go out right and right. You will be on the way to the garden. Thank you, everyone.